Hello and welcome to Traditional Chinese Medicine, Fibromyalgia. My name is Christina Kapothanasis. I am a graduate of the Shanghai University of Traditional Chinese Medicine and a licensed acupuncturist here in the state of Hawaii. I am also the executive director of the Hawaii Oriental Medicine and Acupuncture Association. Thank you for joining us today. Today we are going to be talking about fibromyalgia, giving a review of fibromyalgia, the definition, the associated symptoms, causes, and treatments in terms of Western medicine and Chinese traditional medicine. We will start with Western medicine and the general definition of fibromyalgia. You may know some of your friends or loved ones who suffer from this disease, and you might know that they suffer from chronic pain and achiness, sore muscles, joints over the whole body, a generalized pain. They may also suffer from insomnia, different levels of trouble sleeping or waking, and they will be easily fatigued after minimal exertion. They usually have specific tender points, points that are painful upon pressure throughout the body. There are 18 of these points, 9 on each side of the body, and the pain is usually bilateral or symmetrical. They feel pain on both sides of the body. Most patients are women. The ratio of women to men is approximately 9:1, and the most common age for patients to present with fibromyalgia is 30 years old through 50 years old. The pathology or causes of the disease in Western medicine is not completely explained. They are still conducting research, but they have several causes, several ideas of causes to explain the symptoms of fibromyalgia. Most of those are conducted with the central nervous system disorders. The first one is the correlation of disrupted sleep. Several fibromyalgia patients will find that their sleep is troubled, trouble falling asleep, trouble staying asleep, and not feeling refreshed upon waking. This restless night's sleep will disrupt stage 4 sleep. Stage 4 sleep is the non-REM or rapid eye movement stage of sleep, and when this sleep is disturbed, it can bring on different symptoms associated with the fibromyalgia syndrome. They have proven this by doing studies on patients who are not experiencing fibromyalgia and disturbing their 4th stage REM sleep with alpha waves. When they do so, these patients who are not previously experiencing fibromyalgia symptoms may start to experience the generalized pain and or weakness that fibromyalgia patients are experiencing. They also find a trend of the growth hormone production. Growth hormone is responsible for repairing muscles and repairing the strength that can come with overexertion. Growth hormone is secreted during the 4th stage of sleep. So it makes sense that if the 4th stage of sleep were restful, the growth hormone were secreted normally, and the muscles were repaired, patients wouldn't be experiencing such tremendous amounts of chronic pain and fatigue. Another trend they're finding is the cortisol levels. They have a reduced response to stress, whereas some people experiencing stress may have a spike in their cortisol levels. The fibromyalgia patient may have a lower spike. I can clearly remember one patient that sticks out on my mind who would always tell me, "I do not feel stressed, ever." And I thought, you're the only one. So this kind of a weakened response to cortisol and the lower cortisol response can also sometimes indicate a problem in the hypothalamic pituitary adrenal axis. Some patients are also presenting with hypothyroidism. Some kind of autonomic dysfunction has also been suggested to play a role in fibromyalgia. They can find that some of the disturbances in autonomic and peripheral nervous system may also account for some of the symptoms like Sjogren's. They may have severe dryness of the eyes, dryness of the mouth, or Raynaud's disease, where the fingertips are cold. They are very sensitive to cold, and they may even turn purple. Many studies have also been done to try to determine if there's any inflammation in the musculoskeletal joints where the patients are feeling discomfort, but they cannot find specific signs of inflammation. Some doctors will say that this is a psychiatric problem, though I would say most patients experiencing this would not like to be labeled like that. Symptoms can vary. That's why they call this a syndrome, fibromyalgia syndrome, meaning a cluster of symptoms together. The one symptom that is necessary in terms for diagnosis would be the generalized pain. Patients can describe this pain as achiness or soreness. Some patients might also say that it's a burning or gnawing sensation. They usually feel the pain constantly, though it may flare at different times of the day for different people. Most people will feel more stiff and more pain in the morning upon waking, and it may improve throughout the day with movement. They usually feel extremely fatigued and have exhaustion quickly compared to other patients without fibromyalgia. Numbness in the hands and feet is also another common symptom, as well as sensitivity to cold, like we mentioned the Raynaud's disease, where the fingertips may even turn purple, white, or blue. Insomnia being a very common thread, trouble falling asleep, waking up several times during the night, tossing and turning. Several of my patients also have very vivid dreams or nightmares that they can remember when they wake up, and they do not feel rested. They feel exhausted right when they wake up in the morning. Migraines and or headaches are another common sign, and anyone who hasn't had a restful night's sleep could find that possibility believable. Lightheadedness and dizziness are other symptoms that often occur. I can even remember patients who had blurry vision and or double vision. Anxiety and or depression is seen with this condition, but it is not necessarily together, and it is not necessarily anxiety and depression the cause of the fibromyalgia. Symptoms are usually made stress with stressful situations. The weather, extreme temperatures, extreme cold, extreme hot, and humid or relatively damp conditions or climates can aggravate the symptoms. Also, overexertion can aggravate their symptoms. Working too long hours or exercising, overexercising, can also be part of the cause of fibromyalgia. In Western medicine, they need a diagnosis. According to the American Council of Rheumatology, they say that you need 3 months or more of generalized pain to be considered for the fibromyalgia label. And if you'd like this diagnosis, you have to prove that you have 11 out of the 18 tender points, 9 points on each side of the body, and those points are located in the base of the skull. You have 2 points relatively close to each other on the back of the shoulders here. There are other points here on the neck and under the scapula. You have points here on the elbow on each side, in the back, the lower back, on the hips, and on the inside of the knees. So if those points are painful upon pressure, then you have a possibility of being diagnosed with fibromyalgia. Unfortunately, this is a difficult syndrome to diagnose because there are no abnormal laboratory test findings. Usually people can come out with a clean bill of health, and they may say you need to rest more or go home and don't work too much. Sometimes, though, this condition can be seen in conjunction with other diseases like rheumatoid arthritis and or lupus. People can present with hypothyroidism, Sjogren's disease, which is the extreme dryness, eyes, mouth, skin, and other bodily fluids secrete very little. Lyme disease is also seen concurrently with fibromyalgia, as is chronic fatigue. those diagnoses may have abnormal laboratory findings, but they will also not exclude the diagnosis of fibromyalgia. The treatment in terms of Western medicine is usually antidepressants, partly for the anxiety and or depression, but it's more so to help the patient get into a deeper sleep so they can have a nice fourth stage sleep and not have a disrupted fourth stage sleep by the alpha waves, and so that they can also increase the secretion of the growth hormone to improve their pain throughout the day. The second treatment is usually painkillers on the scale of Tylenol, and the stronger painkillers, the opiates and or the steroids such as prednisone, are actually contraindicated. They usually do not help as much with the pain, and in terms of Chinese medicine, they can definitely hinder. Chinese medicine classifies the painful joints in the bizhen. This is joint pains of different severity encompassing several different Western medical diseases, but the common theme running behind bizhen is the pathogens, external pathogens of heat and or cold, coupled with wind and dampness. These may sound foreign to the Westerner who is very well educated in the Western medical terminology, and these pathogens may seem a little bizarre. But this is the Chinese medicine diagnostic tools that we use, and we diagnose also with the tongue and the pulse, listening to the patient tell us their symptoms and palpating the body. We usually find that the spleen, liver, and kidneys are responsible for the symptoms of fibromyalgia. The spleen in Chinese medicine is controlling the muscles in the body. It is also responsible for, it is the root of our digestive system. It is responsible for creating the blood and qi that keeps us energetic. So if our spleen is weak or has been weakened by overwork or overexercise or a poor diet, several reasons, then we may be experiencing weakness and or pain in the muscles. Weak spleen will also create dampness, which is one of the three main pathogens responsible for joint pain. The liver is usually the #1 organ that is affected in several diseases of modern society, because the liver is where we hold our stress. So in the modern hectic daily life of work and family and friends, stress will always affect people. And the first organ that will hit is the liver. As soon as we start to have liver qi stagnation, we can continue the ball rolling and may develop into liver yang rising. It may start to turn into heat and boil off our good quality blood and fluids, so you can see the liver blood and the liver yin yang being the basis of Chinese medical diagnosis. So the yin is the blood and the fluids in the body. We say the liver yin can be damaged as well, and if this progression continues, it can start to affect the kidney yin. The liver is also responsible for controlling the tendons and ligaments in the body. So if we have poorly nourished, not well hydrated ligaments and tendons in the body, you can also see how this would lead to more aches and pains throughout the entire body versus just one joint. If the liver is creating heat in the body, heat rises naturally, and we have discussed in earlier episodes about how heat rising can disturb the heart, which controls the mind, and therefore we see the symptom of insomnia, sometimes quite severe. If this heat from the liver that is bound up from the stress in our lives, coming from several different factors, is too strong and burns off the liver blood and fluids too long, we talked about it hindering the kidney yin. When we have the kidney yin deficiency, we are definitely getting to the deeper level of harm to the body, and liver essence and blood from the liver are interchangeable. So when the liver is damaged too long, it starts draining our kidneys. What happens when the kidneys are drained? The kidneys are responsible for controlling the marrow and the bones in the body. If this is weak, then it is, or deficient, it is easier to have the pathogens of wind and dampness. As you remember, the syndrome, the B syndrome, the aches and pains in the body are having the pathogens of heat or cold, and here we go, wind and or dampness. So when the marrow in the bones is weak, the kidneys are weak, controlling the bones, then we are more susceptible to have those pathogens come into the body. How do we get that? It can be living on a very windy island like Oahu or the Hawaiian Islands. It can be living in damp conditions. If you are living nestled in one of the valleys where it is quite misty and humid and living in moldier conditions, this is another way to create dampness from our external environment. And from internally, we can also create this through stress and our diet. Spicy foods to the extreme can create wind. Too much oily, rich, and sticky foods and dairy, heavy meats and oils can create the sticky condition in the body that we've also talked about in our other diagnostic lectures, and that is created into a condition that we call dampness. So this is an overview of the explanation of the root of fibromyalgia in Chinese medicine. We can differentiate their syndrome according to the different organs and the different heat, cold, and deficiencies letting in the wind and or dampness, according to each person's specific symptoms, tongue, and pulse. We will check if they have irritability and or menstrual irregularity. That's usually seen with the pain and fatigue and insomnia at the lightest level. If it goes down to having the liver yang or the heat rising, they can start to experience the headaches and or the migraines. Some patients may have a bitter taste in the mouth, and that is usually when the insomnia will become a little more progressed. If it takes a turn and starts boiling off the fluids and the blood in the liver, we can start to see blood deficiency signs, pallor in the face, tongue, or nails. They can also have scanty periods and possibly start to experience numbness or tingling in the fingers or toes. Kidney yin deficiency, they can experience night sweats. They can also start to experience blurry vision or double vision. And if the condition is untreated for too long, then in Chinese medicine, the yin and the yang are quite inseparable. So one may bring the other one down, kidney yang leading to kidney yin deficiency leading to kidney yang deficiency. If the liver starts to affect the digestive system, patients may start experiencing bloatedness or diarrhea and or constipation. They may lose their appetite. For all these different symptoms, syndromes, we would treat with a selection of herbs. We usually use about 10 to 15 herbs in a formula, and I brought a small selection for you today. The first two herbs I have here on the side are cai hu and zhike. These herbs are excellent for taking out the liver stagnation, and cai hu has an upward motion, zhike has a downward motion. It's excellent for regulating the flow of qi in the body and helping for the liver to unwind. We can also use herbs that are good for building the blood, are good for calming down wind, helping with circulation and building the kidneys, taking out wind. We have baisao here. We have huainiu shi in the front, excellent for building liver and kidney and taking out excess dampness. If the patient is suffering from severe kidney yin deficiency, we may need to build the kidney yin. We can build that with several different herbs. We can build that with shihu, nuzhenzi, hanian cao. I brought shendi here today, which is excellent for helping patients to replenish their yin and cool the blood. We can also build the digestive system and calm the mind with the zhigancao. This is honeyed licorice. This is prepared by roasting the licorice in honey. That is excellent for calming down the mind and helping with the insomnia, helping people to get into the deeper sleep. We can use seeds like the swanzalren. It's helpful for nourishing the heart and the liver blood, and it will help patients to get into a deeper sleep. Or we may want to nourish more of the yin with some baihe. It can help with the sleep, and it can start to nourish the yin or the fluids in the body. I have found that here in Hawaii, many people suffer from yin deficiency, something like dehydration, but it can't be fixed with drinking more water. This idea of a low fluids in the body creating heat and all of the symptoms that we have been going over with fibromyalgia. It is a lot of the symptoms I see here are correlating to this deficiency of fluids and creating heat symptoms, which the herbs, acupuncture, and a diet that I prescribe is very helpful for. It really works much better when you do everything in conjunction. The effects will be stronger and the results will be faster. We usually boil the herbs into a tea, or we also offer powder to take the different kinds of herbs. In addition to these herbs, there are several others to choose from. We may use herbs to nourish the kidney, like guiban or shihu nuzhenzi haniancao. We may want to build up the digestive system more if they're really suffering from fatigue with huangqi or dangsen, baizu, or fuling. If we would like to, if we can nourish the yin enough to put in kidney warming your herbs, then I think we will be able to really get to the root of the problem and focus more on a long-term cure. We may focus on herbs like Lu Jiao Shuang or Ba Ji Tian or Shou Di, but it is very important to work in the order of the symptoms that are presenting and work our way backwards, and we cannot just start by warming the kidneys. So if you can find an acupuncturist in your area that can work with you on this, that would be the ideal instead of self-treating. Next, I'd like to show you a sample of acupuncture, and I have invited one of my guests with me today, a fellow acupuncturist here in the islands, Nathan Zhen. He is also a graduate of the Shanghai University of Traditional Chinese Medicine, licensed acupuncturist here in Hawaii, and a director of the Hawaii Oriental Medicine and Acupuncture Association. So we will have him lie down here for us today, and I will demonstrate some of the points that we may use in a typical office visit. We usually don't have a specific diagnosis as only liver or only spleen or only kidney is damaged. It is usually a cumulative effect of all the organs working together, and we may see other organs that are also affected. We do both sides of the body, but I will maybe for today do the side that's closest to the camera. We work to take out heat, and we'll work a little bit on the digestion and the kidneys. The needles are stainless steel and disposable. They are hair thin, so don't think of needles as painful. We would start by needling this point here. This is hegu. This point is excellent for circulating the blood, boosting the qi, regulating the digestion, and clearing heat. This point, along with the point in similar location on the feet, tai cong, this is on the liver meridian. This point is also excellent for taking out the heat in the liver and regulating the flow of qi and bringing the liver yang down, whereas it may be rising and causing the headaches and different symptoms in the head. These four needled together are a very strong pair for regulating the qi. We may also choose chu chi here on the large intestine to help take out some of their heat. This point is also excellent for relieving dampness, which we discussed as being one of the 3 pathogens responsible for joint pains. If they are having a very slippery pulse and red tongue, I might choose Waiguan, which is excellent for taking heat from the exterior of the body. And I may pick Xue Hai here on the spleen meridian, which is very helpful for circulating the blood and cooling the blood, and it works very well with the Qi point in combination. If we wanted to work on a patient that has a little bit more severe condition and their kidneys are already starting to be damaged, we may come down here and do Tai Chi on the inside of the ankle. That is going to build the kidney yin and the kidney yang. We may also pick Fulio or Rangu. Any of the points here on the inside of the ankle are usually going to be excellent for these types of conditions. Sanin Jiao, if there's a lot of dampness. We may pick Qi Hai here on the lower abdomen to not only help with the kidney qi, but also that will indirectly help with the digestion. If their digestive symptoms are already becoming apparent, the most common point that most people know for digestion is Zhu San Li here on the outside of the calf. And we don't have to stimulate strongly. There are several different types and depths of acupuncture. As I said, we would usually do the points on both sides of the body, and we would leave the needles in for about 20 to 30 minutes and then remove them. These points can also be done on yourself. We call this acupressure without the needles. For example, if we wanted to stimulate the point here on the hand, He Gu, we would come with our hand and squeeze until you feel a nice sore sensation. It shouldn't be painful, but you should feel a nice sore pressure. Any of the points that we did today, we may send people home with those so that in between appointments they can give themselves that much more of a boost to their treatment and hope that they will feel the effects that much faster. If you have any more questions, please don't hesitate to call us or email us. We may be able to help you find a practitioner in your area if you are not in Honolulu. Thank you so much for watching today, and until next time, mahalo.